Welcome to the Obesity Prevention and Control in the Workplace conference call. My name is Richard and I will be your operator for today's call. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer session. Please note that this conference is being recorded. I will now turn the call over to Mr. Craig Thorne. Mr. Thorne, you may begin.
Good morning, everyone, and welcome to this exciting webinar from the American College of Occupational and Environmental Medicine. My name is Dr. Craig Thorne. I'm a member and a fellow of the American College of Occupational and Environmental Medicine. My primary practice interest is in population health and workplace health promotion, like many of you. It certainly is my pleasure to moderate today's webinar titled Addressing Obesity Prevention and Control in the Workplace. We have a number of very renowned speakers today, all associated with the Centers for Disease Control and Prevention, the CDC in Atlanta. There will be two different presentations but related today. The first presentation will be given by various members and affiliates of the Division of Nutrition, Physical Activity, and Obesity of the CDC, and they all work on workplace health programming. We have two public health analysts, Mary Hill and Tina Langford as well. We have Dr. Brooke Belli. The second part of the webinar will be then handed over to Dr. Pam Ulweis, who many of you may know through the Health and Productivity section of the American College of Occupational and Environmental Medicine. And Dr. Ulweis is from the CDC Division of Diabetes Translation. She is an endocrinologist by primary training and an occupational medicine physician. And she is also a member of the Worksite wellness team at the CDC. And she will be presenting the new workplace scorecard from the CDC related to obesity prevention and control. So I want to hand over now to Tina, Mary, and Dr. Belli to begin the presentation.
Good morning. This is Mary Hill. Can everyone hear me on the call?
Yes.
Yes, ma'am.
Yes.
I will give a brief overview of the obesity issue and why it is important to address obesity in the workplace. So at the CDC 2012 Weight of the Nation Conference in Washington, D.C., data was presented that in 2030, 42% of American adults will be obese, and about 1/4 of that group will be severely obese, a condition that shortens life and incurs large medical expenses. We must explore ways to fight the obesity epidemic on all fronts. The workplace is one setting to address obesity prevention and control. And I need to have the slides advanced. Doris, can you advance the slide? So I'll just go ahead and give you the outline for the presentation. We will discuss the importance of obesity prevention and control in the workplace, along with strategies and resources to address the obesity issue.
Folks, we apologize. There is some technical difficulty with the presenter advancing her slides, and so we're working with the host to try to fix that problem. Bear with us, please.
I'll just continue while we work on that problem. CDC Director Dr. Tom Frieden describes obesity as a winnable battle. He states, obesity continues to be a major public health problem We need intensive, comprehensive, and ongoing efforts to address obesity. If we don't, more people will get sick and die from obesity-related conditions such as heart disease, stroke, type 2 diabetes, and certain types of cancer, some of the leading causes of death. In addition to the health-related costs, there are also economic costs associated with obesity. The annual health care cost of obesity for all adults is approximately $147 billion. Obese person costs approximately $1,400 more annually for medical care than a normal weight person. Full-time obese employees cost $73.1 billion annually for medical expenditures, absenteeism, and presenteeism. And obese employees have higher rates of absenteeism and disabilities and lower rates of productivity.
I'm just interrupting briefly to see if Pam or Craig, who has maybe signed in as Doris, could just double-check their computer and see if they can move the ball. I really need illustration, but we'll just keep going if we don't see it move.
Okay, there's nothing I can do on my end. This is Craig Thorne, but I've certainly sent out SOS to the host and to ACOEM.
Continue, and we can. Okay. So why employers? There are approximately 154 million full-time and part-time workers in the civilian labor force, and employers.
Oh,
here we go! Yay!
Okay, we'll tell when to stop.
Okay. Right here. Let's stop right here. Just before we get into why the employers, I wanted to just share this slide. I think this is a slide that shows why obesity prevention and control needs to be, we need to have comprehensive programs for this. As we can see here, obesity affects almost all the major systems of the body, practically from head to feet. So, next slide. So as I was talking about the why is it important for employers to address obesity, I think I mentioned that there are 154 million part-time workers in the civilian workforce. Employers provide health insurance coverage to over 157 million Americans. This includes their workers, dependents, and retirees. And as you can see for the next bullet, the cost of health insurance continue to rise, and employers bear this burden. Also, employers are interested in their employees' health and wellness, as 61% of large companies offer some form of wellness programs in 2008. Next slide. The worksite setting is so important. It has its own Healthy People 2020 objectives focused on it. There are two developmental objectives. The first is to increase the proportion of worksites that offer nutrition or weight management classes or counseling. The second is to increase the proportion of employed adults who have access to and participate in employer-based exercise facilities and exercise programs. And the last one is to increase the proportion of employers that have worksite lactation support programs from 25% to 38%. Next slide. To address the obesity issue, CDC developed guidance documents that consist of principal target behaviors associated with obesity prevention and control. These include decreased consumption of high-calorie foods, decreased calorically sweetened drinks intake, increased fruit and vegetable intake, increased breastfeeding initiation and duration, and increased physical activity. Next slide. also developed the Lean Works website. Lean stands for Leading Employees to Activity and Nutrition. This is a free web-based resource that offers interactive tools and evidence-based resources to design effective worksite obesity prevention and control programs. This also includes an obesity cost calculator to estimate how much obesity is costing a company and how much savings a company could reap with different workplace interventions. The website provides employees with the why, the plan, the build, promote, and how to evaluate their worksite programs. Next slide. So now Tina Langford will talk about healthy hospital initiatives to address obesity. Thank you.
This is Tina. Brooke has stepped out, and we were hoping he had a last-minute call. We were hoping we would have some stall tactics, but even with all the technical difficulties, he's not back yet. So I'm just going to highlight, and if he comes in the room, he can definitely share a couple of the success stories from the hospitals that he knows of. But within our division, we recognize hospitals as worksites, of course, and this is provided to you. Oh, perfect timing. Perfect timing. Come on in, Britt. We're going to switch around a little bit. If you just get on.
Hello, this is Brooke Belay. Can everyone hear me okay?
Yeah.
Yeah.
I guess the host will let me know if I can't be heard. So I wanted to just take a moment to introduce everyone to some of our work relating to hospitals specifically. And as you can see from this slide, here at CDC, we are interested in looking at hospitals as sort of a specific worksite situation, if you will, as possible exemplars of worksite wellness to stand for that mission of health and promoting healthy options. We do have on our website, as you can see here, some resources that we've put together. One of these is a document that sort of outlines some expert opinion and recommendations from a panel we put together in August of 2010. Based on some of those recommendations from that panel, in fact, we developed what we call a P2P or practice-to-practice series, which we hope to continue, but which currently there are about 8 issues at that website, and they explore in sort of a very brief 300-word format some interesting examples of addressing worksite wellness, from food and beverage topics to physical activity to breastfeeding, and we hope in the future to capture different specific set of topics as well. So, for example, in one of the P2Ps, a hospital in Massachusetts described how they went very systematically about engaging their employees, sort of doing a needs assessment, if you will, and making a crucial decision in their mind to go sugar beverage free within their campus. And so that was a very conscious decision they make. They sort of very quickly describe how they went about that and the steps they took from gathering the opinion of their employees to flying it through their leadership and making it a reality. And each issue sort of looks at different aspects of changing those environments and focus on different ways that these hospitals have gone about accomplishing those. And they also talk about some of the issues and barriers that they encountered along the way. Interestingly, you've heard about the Weight of the Nation example so far. On that Weight of the Nation recording site, if you will, we also had a session around food and beverage environments in hospitals at Weight of the Nation. And we had several guests present there, including New York City Department of Mental Health and Hygiene, where they looked at a very cross-sectoral approach. As I'm sure many of you are aware, they engaged multiple folks across multiple sectors, and Mayor Bloomberg put this into effect, and they were really able to do some sweeping changes within those city hospitals, not just around sugar beverages, but around healthy menu items and healthy inpatient menu items as well. And it was all about making those healthier choices the easier ones, using all of the sort of policy strategies and levers that we've discussed. So that was sort of the example set that I wanted to provide, and we're always happy to hear from folks from the field, whether it be about questions or collaborating on something else in the future. So please feel free to contact us.
Okay, thank you, Brooke.
Thank you.
So now it's Tina again, and I'll cover the slide. If you want to change to the next slide, thank you. That's Workplace Health Track that Brooke alluded to. He came in and thought I had already covered it, but it was fine because I wanted him to share some of his examples specifically from the hospitals. So earlier this year, and this is sort of a biennial conference, meaning with an E, every other year, and we hope to have it again. But earlier this year, CDC hosted the Weight of the Nation conference, and it's aimed at practitioners and policymakers. There were 8 tracks, the different settings, and medical was a setting, and so Brooke led that. And there's a lot of information on. You see the recorded session link there. You will get to see by date the different tracks, the different presentations. So within our track, we had 4 half days and 4 sessions, and within those sessions there were 4 speakers, so it was a very packed schedule. It'd be impossible to share with you all the great examples we have, but you can peruse them. But one thing that we did while we set up our track, we really tried to design those around the concept of comprehensive programming for the workplace. So you see that making healthy choices the easy choice, which is, first and foremost what a lot of workplaces do, is create that supportive environment. Next, we have the organizational nudges. These are policies and systems. And then Don't Do Wellness Alone. Those are partnership efforts. And then Reaching Beyond. That went out beyond your immediate traditional partners into community collaboratives. And in the conference, this session focused a lot on coalition building. The healthy choice, easy choice, as you would imagine, we did have a lot of examples of vending programs, walking clubs, the partnerships covered. Actually, that one was a lot of coalition work, and then a downtown wellness toolkit shared by Kansas City, where they partnered with immediate or adjacent workplaces in their vicinity. And then the Reaching Beyond, actually that one went into the community and family as well. So there were a lot of examples of sessions or seminars, and like Eat Smart, Move More, Way Less, North Carolina, extended into the family members. National Safety Council spoke, and they realized that a lot of accidents and injuries as well occur at home more than in the workplace now. So they branched out into offering family being inclusive and targeting their communications to the family as a whole. And then World Cafe, this is a great tool that you could use in your own workplaces that sort of just convenes all the different stakeholders, and there's a topic. It's a cafe format, table format, where you have stakeholders around, and they're all focused around a topic area, and it's like a brainstorm, but what it can lead to is a list of priorities and getting consensus on things. So that was a really good practice that we had at it's one of our practitioner network sessions. And then last, the biggest, I think, product that stays alive, that's the most popular from the Weight of the Nation, is the HBO Weight of the Nation site. They did several videos. These are very touching videos. I would really encourage you to check it out. They do a lot of social media, and they're still doing a lot of dissemination and town halls, from what I understand. So that was Weight of the Nation, and hopefully we'll do another one. So we don't know. So next slide. So and then the next slide. We'll go into a few other resources before Pam covers Health Scorecard. This, the CDC has now released the PA Toolkit. It's available at the URL on the page. This has been just in the last few months. We've waited for a long time. And it basically takes, if you haven't heard of the National Physical Activity Guidelines for Americans on the right, it takes that and translates it to the workplace environment. So lots of things like the business case, how to start small and maybe scale things up. So a lot of good tools in there specifically for physical activity. Next slide. And these, we have several resources you see for improving the food environment. The dietary guidelines is provided on the right. And then to the left of that, we have both the Improving the Food Environment, which was a product out of our Heart Disease Stroke Prevention branch, and the Health and Sustainability Guidelines for Federal Concessions and Vending Operations. While this is directed to federal settings, it's definitely transferable to any workplace. But in the former, the top resource, Improving the Food Environment, it basically kind of walks you through the process of adopting policies, implementing them, evaluating them, while the latter one, the one on the bottom, the guidelines for federal concessions, it actually gives you specific standards and what might be sort of a standard you could set and then an above standard. Anything from the actual food content, like the sodium and the fat levels and things like that. So it's the actual standard that we're trying to do in our own contracts at CDC. This is a new thing for all of government to be to meet this recommendation. So this is a great goal if you want to look at it and use it for your own workplace. Next slide. Now, the Healthy Weight Research to Practice series was one of the earlier works of our obesity branch, and it helped set the stage for today's target areas. And these are consumer friendly, so that's why I'm sharing them, because they should work well with your clients. And you see a few popular ones on the screen there, Rethink Your Drink, portion sizes, and eating fruits and vegetables to lose weight. And we also have a consumer web page that's the CDC Healthy Weight web page, and it just goes into detail talking about the balance. But each of these products are, they're not in print, but they're downloadable, or you can print them in color, and one of them even includes a PowerPoint presentation that you could give as a training. Next slide. So ideally, a large part of the interventions that we set in place for obesity prevention are those in the environment and the policy setting. And so these are just listed here, some common examples of policies that support a healthier environment. So you have a mix of some ones that promote or support physical activity, and then also the food environment. And the URL provided there, it's a little small, but it's our Healthier Worksite Initiative, DNPO/HWI. And if you just do cdc.gov/HWI, you'll get the main site, and you can go from policies to toolkits and just surf around. And there are a few example policies there. Next slide. Okay, so this concludes our portion of going through the resources, and now I'll turn it over to Dr. Pam Allweiss so she can tell you about the Health Scorecard.
Well, thank you very much. This is a tool that is posted, and all of the slides you've just seen as well are all posted on the Health and Productivity website of ACOEM, and they'll all be posted later today. But this tool just came out, and it was a few years in the making because people wanted an evidence-based, validated tool that Worksites could use to see where they were in their health promotion programs. We all know that health promotion programs might be useful. We know the burden of chronic conditions, and there were several scorecards out there, and the Division of Heart Disease and Stroke Prevention took the lead on this, and they wanted people to have evidence-based comprehensive health promotion programs. So certainly the audience for this scorecard would be HR folks, ACOEM folks, anybody who is in charge of a worksite program. There are 100 questions, and we tried to get a live link so I could guide you through it, but it didn't quite work this morning. So you do see the link on the bottom. But there are 100 questions, and every single question has an evidence base behind it. The CDC Worksite team has representatives from diabetes, cancer, tobacco control, DNPAO, etc. And we all gave input and we all got articles to support any intervention that would be on this scorecard. And we worked with the Emory, with Ron Getzel's group, the Health and Productivity Institute there, and they validated it with 93 companies. So it's very possible that some of you might have participated in some of the outreach that we did. But we used the input from these companies to further improve the 100 questions. And it gives people a baseline of where they are and also where they could be. So that we have different sections. So, for instance, one general section would be organizational support. If you go on the website, there's actually a manual on how to use this tool at your work site. And the questions come up, and the person filling it out, as I said, could be the ACOEM professional, could be the HR person, the wellness coordinator, somebody who knows what their program is doing. So I'll give you some examples of just like the general organizational support questions. One, it'll say, during the past 12 months, did your work site conduct an employee needs and interest assessment for planning health promotion activities? And it's a yes or a no, so you would get a point for that. Many of the ideas about support from the top, etc., are demonstrated here. Has your worksite demonstrated organizational commitment and support of worksite health promotion at all levels of management? So these are the types of questions in general. It will ask, is there a champion? Do you have an active health promotion committee? And we know that all these things are important, but at least with a checklist like this, people can actually say, okay, if there are, let's say, 18 questions, well, currently our worksite is doing 10 of them. We know where we need to prioritize to fill in the gaps. And then each, let's say, condition will have a section. So I'm going to go over some of the nutrition and physical activity questions. So, for instance, in the past 12 months, did your worksite provide places to purchase food and beverage? Do you have a written policy or formal communication that makes healthier food and beverage choices available in cafeterias or snack bars? Now, these questions, as I said, were based on interventions that seemed to work. So that's how we picked all of these questions, okay? Another question, make more than 50% of the food and beverage choices available in vending machines, cafeterias, as Tina was talking about. Provide nutritional information. These are all things people think about, but these are all listed on this scorecard. For instance, provide free or subsidized self-management programs for healthy eating. And we go through this for some of the other conditions as well: tobacco cessation, diabetes control, heart disease and stroke. Very important, are there any self-management educational resources for your employees? Basically, it's for people to score themselves, to know where they are and where they could be, so that if they do have a program or they're thinking about putting in a program, they can score themselves and kind of compare them to a benchmark to other work sites. Also in this scorecard kind of guide, there are other resources as well. For instance, the state health departments can sometimes give technical assistance, especially for heart disease and stroke. The other thing is you can also use this to demonstrate any progress that your company might have done, and you can identify the highest impact strategies that may not be currently in place at your work site. Now, we know every work site has a different has different demographics. This we know. But certainly some of the general ideas, the organizational supports, would be applicable for all of them. So that's some of the background. And we'd love for you to go online, look at it, see if you're just starting or almost to get a report card on your work site. The other thing is we know that a lot of companies have multiple work sites, and some folks are using it almost like as a contest, okay? If you have 10 work sites, which programs are implementing the most evidence-based practices, et cetera. And as I say, it isn't almost like a value, but it's a benchmark to tell you kind of where you're at and where you need some improvement. So we hope that you'll go. There's a manual to do it. And as I say, there are 100 questions, so we can give you a great scorecard. And a lot of the resources that support these interventions are also listed on the website as well. If you can advance it just to the last slide, I think there's a list of some of the other resources as well. So the Health Scorecard, CDC has a general workplace health promotion website. The National Healthy Worksite is a CDC-sponsored program that was presented a few months ago. And there are 7 regions, and there'll be about 100 to 150 companies, again, looking at evidence-based interventions. And there, you can go on that site and also get some general resources on how to set up some programs. There are specific things about obesity and physical activity when we're looking at the interventions as well. So as more webinars are being developed, they will all be on the website, so you have one-stop shopping. You can find a lot of these resources there as well for your program. So we wanted to go over some of the general tools, some of the resources. Everything is in the public domain. Everything will be posted on the Health and Productivity website. And just to conclude, this Healthy Worksite Scorecard can be used if you're just setting up a program or as a report card. So I'm going to turn it over to Craig for any question and answers, and also to simulate any other thoughts or any input from the people on the call. Maybe you can tell us some programs that have worked and that haven't worked. So take it away, Craig.
Great. Well, I want to thank you, Dr. Olweis, and to Mary, Tina, and Dr. Belay as well. We all know that the Journal of Occupational Environmental Medicine in particular over the past several years now has certainly educated us on the challenge of workplace-sponsored obesity management programs. But the good news is that we also read of reports that there are reduced medical costs and reduced absenteeism, and certainly a number of positive health outcome indicators associated with our efforts as leaders. I do think that these tools are excellent. I think that all speakers have done an excellent job at giving us the bones of their tools and enticing us to look further. I do think that the scorecard, the CDC scorecard in particular, because it is evidence-based and it's based on evidence from programs that now have been sustained, is a tool that in particular many of us will be interested in. So I want to thank the speakers and congratulate you on meeting the goals of the webinar. I'd like now to turn back over to our host operator to open the lines for questions and answers. But I also believe that we have time, as Dr. Olwey suggested, for you to lend your experience to the other participants as well. So you may ask questions, or you may give us comments and some of your own successes and challenges as well. Thank you again.
Thank you. We will now begin the question and answer session. If you have a question, please press star, then 1 on your touch-tone phone. If you wish to be removed from the queue, please press the pound sign or the hash key. If you are using a speakerphone, you may need to pick up the handset first before pressing the numbers. Once again, if you have a question, please press star, then 1 on your touch-tone phone. Standing by for audio questions. I'm showing no questions at this time. And pardon me, I'm showing no questions at this time.
Well, this is Pam. I have a question I'd like to throw out to the audience. Just as a question, do any of you, I assume, have some obesity initiatives, and how did you decide to pick whatever obesity prevention initiatives that you had? Did you go to vendors? Did you kind of look for programs? Was it word of mouth? How did you all kind of pick whatever obesity prevention program you have instituted, or if you're planning on instituting one, how are you deciding to select a program or programs? And I know that, Craig, you've been looking for your company at some different programs, so what were your thought processes on trying to find a program or programs?
Sure. I would be happy to begin this dialogue, and hopefully others will participate as well. I've been looking for a couple of years now at implementing a sustainable weight management program, not just sort of a plug and play, but a program that is evidence-based and is shown to be sustainable over time, and to certainly work with employees to entice and incent them for participation in the program. So as background, what I did was certainly study the business case for a company such as ours. I work for a company called Erickson Living, Continuous Care Retirement Communities. I oversee the employee health. And our business case looked at essentially what we're paying out in our self-funded health plan. Private insurers pay about $1,140 more per year for overweight employee or beneficiaries versus those that have normal weight. And pharmacy costs are predicted to be even higher at 105% because of the chronic conditions that need to be managed that are associated with obesity, namely diabetes and arthritis and heart disease, stroke, depression, and so on. And so what I did is use the 2 pillars of an occupational health program that we're taught. The first pillar is to secure leadership support of the program, and that's where the business case comes in. But on the other pillar of a strong health program at the workplace, the input of employees. So, Pam, what I did was convene a task force involving frontline employees, managers, and leaders, and had a series of structured dialogues with them, sort of a structured support or focus group process in which I got their input on what they felt were barriers to sustainable weight loss, including environmental factors in their particular work sites, looking at cafes and looking at vending machines, et cetera, but also really asking them what they felt would be the components of sustainable weight management program. What we ultimately decided on was several things. One, we felt that our employees, for the most part, lack basic nutrition education. Again, these are sometimes lesser educated employees, and some of them were not even born within the U.S. And so what we did was put together and pilot a nutrition program called Healthier Choices, which we have taken from the Choose My Plate, the USDA programs, and spent curriculum development time making workshops, basically, for interactive sessions to teach people portion control, how to read food labels, what foods to choose, eventually what foods to minimize or avoid, and then how to eat better at work and at home. And then we gather data on their self-reported eating habits, their pre- and post numbers such as blood pressure and cholesterol levels after 6 months, and basically their opinions as to whether or not they felt that this was going to sustain changes. And that's been successful, and we will be rolling this out to all of our employees at all sites. The second component that the group wanted was a sustainable weight management program at the Worksite, and we're entering into a national contract with Weight Watchers at Work, or now Weight Watchers Health Solutions, as it's called. And we get a 20% discount through a group effort. And I'm putting in a hybrid approach in which we advance half of the payment through a wellness fund for the employees, and then the employees pay the rest of their monthly fees, which equates to about $14. And if they attend a weekly class, whether at the work site or externally, 75% of the time on a weekly class, we will rebate them their proportion or portion for attendance. And then thirdly, and I'm really happy to attend this webinar, we've been looking for best practices around organizational nudges and policies, as a couple of the presenters alluded to, particularly Tina. And I'm going to be going on site and looking at a policy to make sure that our vending machines and our cafe menus, et cetera, are really more accessible, so that indeed making the healthy choice the easy one is something that we put into policy format. Finally, in our program, and we're just starting on this program, so I don't have outcomes, but I certainly adopt best practices. We're looking not just at nutrition, but physical activity. So a number of the tools that were mentioned today will be helpful to us, but we offer on-site gyms, et cetera, to support not just nutrition and healthy weight, but certainly physical activity as a part of our comprehensive program. Are there others on the call that want to lend their experience, particularly if they have outcomes related to their efforts?
If you have a question or comment, please press star then 1 on your touch-tone phone. Again, that's star then 1. And I'm showing no audio questions at this time.
Well, I thank everyone for attending the webinar. There are a number of websites and tools that are available. The slides will be posted on the Health and Productivity section of the ACOEM website later today. I apologize for the technical difficulties, but the materials will be available. I want to thank the speakers for today's webinar: Mary Hill, Dr. Belay, Brooke Belay, Tina Langford, and Dr. Pam Allweiss. And I certainly want to thank Doris Kunicki from ACOEM as well for her organization in the event. Thank you very much for participating.
Thank you, ladies and gentlemen. This concludes today's conference. Thank you for participating. You may now disconnect.